cousins, friends, they're fighting with me till the end. It's a battle we know we can win. That makes them heroes too. We're chemo heroes. We're helping out. We're chemo heroes. That's what love's about. Yeah, 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 yeah. Everybody shout. Bad cells, we gotta get rid of these bad cells. I'm a chemo hero. We're gonna get rid of them. Yes, we are. Lost my hair, but I don't care. Lots of scarves and hats to wear. Yeah, 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 yeah. You know, old Fuzzy Wuzzy was a bear, and Fuzzy Wuzzy had no hair. He was a chemo hero. That's right, yeah, 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 yeah. I'm a chemo hero, and that's a fact. Yeah, yeah, I'm a chemo hero. Yeah, yeah, and I'm fighting back. Yeah, yeah, I'm a chemo hero. Yeah, yeah, and that's a fact. Yeah, yeah, I'm a chemo hero. Yeah, everybody shout. Yeah, 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 I'm a chemo hero. Doctors, nurses, needles, pins, they've come to poke on me again. Seems like these treatments never end. But I'll be better soon. Sometimes these treatments make me mad, make my mom and daddy sad. Sometimes they make me feel so bad, but I'll be better soon, 'cause I'm a chemo hero. Yeah, yeah, that's a fact. Yeah, yeah, I'm a chemo hero. Yeah, yeah, I'm fighting back. Yeah, 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 yeah.
Hello, Daddy.
Sisters, brothers, cousins, friends, they're fighting with me. It's a battle we know we can win. That makes them heroes too. We're chemo heroes. Helping out. We're chemo heroes. That's what love's about. Yeah, 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 yeah. Everybody shout. Bad cells, we gotta get rid of these bad cells. I'm a chemo hero. We're gonna get rid of them. Yes, we are. Lost my
You can't see your face.
lots of scars and
Let
hats.
the light shine on your face.
Yeah, 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 yeah. Do you know, old Fuzzy Wuzzy was a
Let the light.
Fuzzy Wuzzy had no hair. He was a chemo hero. That's right. Yeah, 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 yeah. I'm a chemo hero, and that's a fact. Yeah, yeah. I'm a chemo hero. Yeah, yeah, and I'm fighting back. Yeah, yeah. I'm a chemo hero. Yeah, yeah, that's a fact. Yeah, yeah. Chemo hero. Yeah, yeah. Everybody shout. Yeah, 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 yeah. I'm a chemo hero. Yeah, yeah.
Okay, he's here. Mama, you can start. Hey, Beams, what's up? Hi, Dr. Uzoma. Hi, Winifred.
Hello.
Hi, thanks for joining us. Everyone, this is Dr. Uzoma Nwakuche. Winifred, can you start with the introduction?
Hello, everyone, and welcome to another special edition of Oche Kitchen Discussions. Today, we are going to be talking about surviving cancer. What is cancer? How do we prevent cancer? What causes cancer? Does cancer have a cure? All these questions are questions we're going to be throwing at our panelists. But before we do that, I would like to introduce my co-hosts, starting from IJ Ndoku, OJ Gweke, Gorgeous OJ, and Ifi Moma Mbadinuju, my own sister.
Hello, everyone.
IJ, over to you. Introduce the panelists.
Okay. Thank you everybody for joining us. Today we're going to talk about stand up to cancer. And Kayla Mills wrote, "You never know how strong you are until being strong is the best option that you have." Having said that, we're going to introduce a very strong lady, a hero by the name of Solumkolia Obi Anazodo. She's a mom, she's an entrepreneur, and she's a survivor. So she's going to tell us her story. Solumkolia, welcome to the floor. And after that, we're going to have the doctor, we're going to ask the doctor some questions.
Okay. Hello. Can you guys hear me?
Yes, we can, yeah.
Hello, everyone. Can you hear me?
Yes, we can.
Fantastic. Thank you very much. Thank you. Thank you. Thank you. Thank you for having me on Oche Kitchen.
Thank you.
I'm going to greet you guys in because of Oche Kitchen.
She's having a connection problem.
I see that, yeah.
Yeah.
Just to say thank you for let me see if I can swap my internet just quickly, but I'll keep on talking. Thank you for having me, and it's a privilege I don't take for granted, and it's a privilege when I'm able to tell my story and able to encourage women who possibly might be going through cancer or have just been diagnosed or are just survivors, people that have just survived cancer or
I think she's switching her Wi-Fi or something. So please bear with us for like 2 minutes.
Wi-Fi connection.
If I'm a happy birthday, answer me now. Happy birthday.
Thank you very much, Benson. I'm sorry, I didn't hear earlier.
Since even chat, I send the chat, happy birthday.
I'm so sorry. I'm so sorry. It's just been a tough day for me today. But thank God. Okay. So while we're waiting for Kolia to come back.
Ugeza is saying happy birthday, dear Ifi.
Yeah, I can see.
sorry guys, I lost my connection, but my connection is sound now.
That's
so
good.
My journey began in March 2018. I was having a shower and I noticed a lump in my breast. However, I didn't take it as, I didn't have any kind of thinking that it might be cancer or anything.
Of course.
Usually once a year, I go away on holiday with my girls. So that year we my normal holiday, my normal bubbly self. People that know me very well know that I'm a very active person. So I went on my holiday. We joked. When we got on the holiday, we joked about it. But coming back from my holiday.
Sorry, you joked about the lump or what?
I just discovered the lump on the breast. So we joked about the lump. Yes, we joked about the lump, and I didn't take it as anything. So I got back from my holiday, and I got a letter from my GP asking that I come in to do smear test. So I said, okay, I might as well use one stone and kill two birds. I called up my GP, booked up an appointment, went to the hospital, and went to the GP. The GP looked at it and said, where it was, it might not be anything. But because of my age, he said, have you ever done a mammogram? I said, no. And he said, okay, I'll refer you to do a mammogram.
Sorry, how old were you? How old were you then?
How old was I? I was 45.
Okay. Wow,
So
you look good.
Yes, thank you. I'm 47 now. So the doctor referred me for a mammogram, which I went for. And went for the mammogram. That was the first time I did the mammogram. Whilst the mammogram was going through, I noticed, because I look at people's body language a lot. I listened to the nurse's body language, and she wasn't coming out across like, but I just said, okay, maybe it's just their profession. I really didn't think about, anything. So after the mammogram, she said, oh, you need to take a seat. I need to show the doctor the result. So she went ahead, showed the doctor the result, came back and said, the doctor said they need to do the mammogram again. And I said, is anything the problem? She said she's not very sure, but the doctor wants a clearer picture of the mammogram. So I went ahead, did the mammogram. They took it back to the doctor. The doctor said, requested for a biopsy there and then. And I went in for a biopsy. And on that day, the machine broke down. They had a breakdown in the machine. So I was so happy. I was so excited to just leave the place. So they said, oh, you need to wait for them to fix up the machine. I said, is it necessary? Can I come back another day? They said, no, you have to do it today. But if we're unable to do it, you have to come back tomorrow. So the next day I went back and they did the biopsy, very painful stuff. So yes. They did the biopsy, did everything, and I left. So they said, you need to come back in 2 weeks for the result. And I went ahead. I went just normal, went back to my office. And so on the 24th of May, to be precise, was the day I went to get my result. And that was the day my whole life, well, I would say at that moment, my whole life came crumbling down. So a friend of mine came over to my office and said, oh, let's go and have lunch. I said, no, I'm going to go and get my result from the doctors. So she said, do you mind me coming with you? I said, no problem, come with me. I was still at that point, I wasn't thinking about anything. So I went with her and we got to the hospital. We're still gisting. So we got into the doctor's office. They called me, I went in. The doctor was like, he was looking straight on his computer. He wasn't even looking at me. So he said, oh, he went round and round and round and round. Your blood tests are fine. So I said, okay, good. The X-ray we did is fine. I said, good. The scan. So he now said, but anyway, the long and short story of it is you've got breast cancer. Oh. At that moment, my whole life came down. Yeah. The only person I could think about, I did not think about anybody, was my son. He was the only person I thought about. And at that moment, just at that moment, I didn't even wait for the doctor to start talking, saying other things. He said to me, once he said it, in fact, I started crying. I thought about my son, and I said to myself, you're strong, but the tears were still rolling down, So he said, okay, I'll tell you more about it. It's a stage 3 breast cancer, which is you're just 2 points away from being a stage 4, and it's an aggressive one. And that moment he said that aggressive, something in my head clicked. And I said to him, can you cut the breast there and then?
That was your first thing, cut the breast?
Yes. So he said to me, oh, I haven't finished talking. There are other alternatives. He said, the first thing we can do is to start you on chemotherapy. Then we will try to shrink the lump because the lump was quite massive. I guess there's a doctor here.
Yes.
He would understand that the lump that came out was 30 millimeter, which was quite massive. It was like a size of a golf ball, a size of not a golf ball, not a tennis ball. You know the other one, table tennis.
Yeah,
the big
ball.
Yeah. So I said to the doctor, I need the breast cut off. He was like, no, we need to do, mama, you know. And the question I asked him, I said, at that point, I was still, my mind was still, rattling up and down. And at that moment, the devil started, oh, better start sorting yourself out because you're going to die. I didn't say anything. And I said to him, I asked the doctor, do I have a say in my treatment? He said, oh, yes, of course. I said, then, and I said, my final answer is chop the breast. And I made a joke about it. I said to him, when you chop it off, you can decide to go and sell it in India for all I care. I don't really care. So, we laughed about it. He said, okay, since your option is to do a mastectomy, I'll start up the preparation. And, we started up, we called they had to assign me to an oncology nurse and other oncology teams. So I had my team and I was introduced to everyone and we kicked off. Got in, the nurse talked to me about bra sizes, we went through all the medical, but at that time, I wasn't even listening to anything. So I said to my friend that went with me, I said, you better be listening. Maybe that's why God brought you to come and sit with me, because 90% of the information you will be given are all negative informations.
Oh, sure.
All negative informations. There's nothing positive about it. Yeah. All the leaflets they will give you when you read it is either this will happen or that will happen or that will happen. So when we left the hospital, the first person I called was my pastor. He was the first person I called. I spoke to him. I said, I've just come out of the hospital and this is what they said. And my pastor called me and said, listen, you attend this church and we have a covenant of life and long life. I held on to that word and I went back to my office. I called my mother's younger brother, who I'm very, very close to in America. I spoke to him. Immediately, the wife heard what I said because she's a medical doctor as well in the States. She said, what did you tell them to do? I said, I told them to cut the breast. She said, very good. You took the right decision. And the journey began. And nobody aside my mom's younger brother, my parents were not aware. No, my younger sister, my mom's younger brother, and my friend and my boss at work were the only people that were aware. Nobody else from my family knew about it because I wanted to have my sanity to go through the journey. So I had to put up a positive mindset, a positive heart on to go through the journey. And I kicked off, went through my surgery. The surgery was very successful, 8.5 hours of surgery. I did my mastectomy. Same day I did my reconstruction. After 1 month, I kicked off on my chemotherapy. And during the chemotherapy, I found it very dreadful. So I was told, oh, if you wear a cold cap, your hair wouldn't fall off. And after I wore a cold cap, which was very discomforting, very terrible. And the first day of the chemotherapy, by the time I was about to go through the second cycle, because I had dreadlocks, one hair came off. And I was like, you know what? I don't want to go through this emotion, because if you're going through, if anybody has gone through cancer, it's one, psychologically, mentally, emotionally draining. But I said to myself, you are a fighter. So I'm just fast forwarding things so I don't take a lot of time. So I went through, I'd done my mastectomy, done the reconstruction, started my chemo. So I called my my mom's cousin. I had to call her. I told them. So because they started now coming to the house to help out with things. So I had to go to her husband to shave my hair. So I shaved off the hair. I told cancer, I said, you can take the hair, but you can't take my head. It's not possible. And during that process, I held on to God. To be honest, I became very closer to God more. And I held on to his words. And that was when I started to hear clearly. I have a book that I take around. I call it my dream book. So whatever I hear, whatever that comes to my mind, I put it down in this book. So I was going through the journey. My parents were not aware at all. My brothers knew I went for surgery, but nobody knew what it was. So we had to keep it because I didn't want to upset my parents, and I didn't want my mom, because we talk every day. We are very close. So I didn't want my mom calling me on the phone to worry, because I didn't want anything to destabilize my system. So one morning, I woke up. I cried like anything. I was like, what is going on? But one thing I never did, for one day, I never asked God why. Because I said, if I ask him why me? Who is he going to be? Is he my aged parents? Who am I? What am I asking him? So I said, all I knew was I held on to the word, and I said, God cannot give me what I cannot carry. So
Nkolia, so where are you now? Are you in remission or what? Where are you now? Because you have to go to the doctor.
I'm cancer-free.
Hey.
I am cancer-free. So I'm going 2 years and still kicking.
Wow.
2 years and still kicking. And
Thank you.
One thing I know, I always advise women who are going through this is to have a very positive mindset. Because if you don't have a positive mindset, it would mess you up. And again, mentally, you need to be mentally balanced to be able to go through this journey. You need to surround yourself, honestly, with people that would not be telling you, hey, yeah, stage what is it? Do you know Dorak, is it Dorak? Yeah, Dorak Akuyili died of cancer. This person died. I didn't have those kind of people around me.
Thank God.
I had people that spoke positively into my life. And, the journey it was smooth. But the thing that was very amazing to me was I was having my chemotherapy. I was still going to work. People didn't know.
That makes you a strong woman. Yeah.
People didn't know I was going through. Only my people in my office knew that I had cancer. They knew I was going through treatment, but people outside, nobody knew what I was going through. I'd finished my chemo. I go into my office. My boss was like, what kind of woman are you? Are you not? I said,
you're a strong woman.
Thank you. If I'd stayed at home, maybe I would have ended up in that same hospital, because I work in the mental health sector. So if I might have ended up there. So I just needed to be coming out, seeing people, and being strong. So it was a very rough journey. It was very tough. And I finished my chemo. I did radiotherapy as well. So it was a process, but in it all, I always give God thanks, because I'm here today to encourage other women. Every day, every single day, we see people who go through cancer. People are being diagnosed on a daily basis. So
that's why we have the doctor to shed light on some of the things. So just hold on to your thoughts. We'll come back to you.
Thank you.
Oche, can you start with the questions with Dr. Uzoma?
Yeah. Hello, Doc. My first question to you.
Dr. Uzoma, are you here? Uzoma?
Yeah, I can see him.
Okay. Okay. All right. Go ahead.
Okay. So my first question to you is, how common is cancer?
That's a very, greetings, greetings, good afternoon, good evening, wherever you may be.
No.
I know it depends, it's a very broad question. So cancer is not one disease. It's just a name that's given to many diseases. Like you have cancer of every body part. Breast cancer, like our sister talked about, lung cancer, brain cancer, colon cancer. Like almost every part of the body has a cancer or could develop cancer. So asking how common cancer is kind of needs to be a little bit more specific. It's either how common is breast cancer, lung cancer. That's typically what we look at, the incidence of individual cancer. So cancer, broadly speaking, is relatively common. Like breast cancer that Anazodo just talked about, it's pretty common. It's one of the most common cancers in women, and the leading cause of cancer deaths in women next to lung cancer. So cancer is common. Like in the USA, every woman in the USA has a 1 in 8 lifetime risk of developing breast cancer. So it's pretty common. If there are 8 women here, it kind of excludes one of the 8 will likely develop breast cancer in their lifetime. It's also the most common cancers, generally speaking, worldwide, or maybe let's start with where I live and where I practice in the USA. You talk about lung cancer, breast cancer, colon cancer, and cervical cancer for women too. So these are some of the more common cancers. And for men, it's lung cancer, colon cancer, prostate cancer, even the blood cancers, the leukemias are pretty common.
Okay, thank you. The second question is, I hope this is not a very broad one as well. What causes cancer?
It's a little bit broad too, because but you're right, it's a valid
layman's
Just basically.
It's a good question, but it is broad too. So the most common cause of, or anyway, let me put it, the highest risk, or what confers the highest risk to developing cancer is time. When I say time, I mean age. As you get older, the risk of various kind of cancers increase. In particular, the one thing we're all very aware of, and we're sure of that causes cancer is smoking. And smoking causes cancer, not just lung cancer. It causes cancer in everywhere from the head to almost the legs. It can cause lung cancer, cancers of the mouth, the tongue, cancers involving the organs in the neck, bladder, and kidneys. So that's another thing that causes cancer. Another thing that also causes cancer is infections which say hepatitis C and even hepatitis B2 predisposes to liver cancer. Then the human papillomavirus also predisposes to cervical cancer and head and neck cancer. HIV also predisposes to cancer, including
HIV too.
Cancer and did you say something?
No, I'm surprised HIV causes cancer. I didn't know that.
It does, because it depresses your immunity, increasing the risk of cancer. So HIV patients usually or often, if they are immunosuppressed enough, are prone to cancers. Yeah, both lymphomas and cancer in the solid organs.
Okay. So, Doc, can stress cause cancer?
We want to know this. We're all stressed.
Technically no, but potentially yes. Potentially it could cause, but I don't know if there's been a direct link between stress and cancer, but potentially it could, but I do not know that it's documented that stress causes cancer.
The hereditary.
Oche, before you move on to your next question, can we take a minute break and we'll continue?
Yes.
Thank you.
Ma'am. Yes, birthday girl.
Okay. Oh gosh, what's that? All right, what are we seeing?
Welcome to 280 Degrees African Restaurant and Bar. Our well-trained and polite staff are at the ready to serve your favorite alcoholic beverages and cocktails. Music is supplied by the finest DJs in London, and security is tight but polite. Our opening times are Sundays to Thursdays, 1 p.m. to 11:30 p.m. Fridays and Saturdays, 1 p.m. to 3 a.m. We are centrally located at number 280 Kilburn High Street, London NW6 2BY. For phone bookings and takeaway orders, please call 0207 328 8832. 280 Degrees, where the noble class hang out.
Thank you, everyone. Oche, back to you.
Yeah, I'm done with my set of questions. Winnie, can you take it away?
Okay.
Winnie,
Can
skip
you hear
for.
me?
Yeah.
Am I on? Okay.
May I just add that toxins as well promote cancer in the body. The toxins, certain things in your home, and so on, and some type of food as well. Yeah. So those items cause cancer as well.
Oh, that's very true. Yes, sir.
Yes.
Okay.
Thank you.
Okay. Doctor, hi. So my question is, what are the risk factors for cancer?
So we can also break that down depending on the type of cancer. Like the risk factor, the greatest risk factor for cancer that we talked about is advancing age or getting older. If you're privileged to live long enough, your risk of cancer increases with it. So, but for specific kind of cancers, breast cancer, the risk factors are diverse. Some are what you call general, some are personal. Like for the general, we talked about advancing age, and then for the personal, say about genetics. When you have a family history of cancer, your risk of cancer increases, especially if you have first or called close relatives with breast cancer that have had breast cancer. And the more they are, the higher the risk that confers in you. Then individually, having a longer exposure to estrogen, and longer exposure to estrogen include having an early menarche, that's when you start menstruation, and late menopause, and using hormonal contraceptive pills or using external estrogen drugs increases the risk. Nulliparity or not. If you
Can
don't
I
have
ask you
children,
something? Are you saying early menstrual period makes you at risk for cancer?
Yeah, it increases.
So what is early? Because some kids start their menstrual period at 10. So what is early?
So early, I don't define early. Early is defined by when does the average woman start or the average girl start menstruating.
I'm a late bloomer, so most of my friends started at 12, 13.
Yeah, so if you're 12, 13 or 9, 10, increases comparatively. Remember, all these are comparative. It doesn't mean if you start at 8 that you're going to get cancer. Just generally speaking, and these are population studies. So early menarche, late menopause, having few kids or not having children at all. That means you have a longer exposure to estrogen in the body. Yeah, these are things that increase the risk for breast cancer. Then for colon cancer, also includes age. That's age as you get older, exposure to Western diet, low fat, low fiber, high fat, low fiber diets.
Yeah.
That may also increase your risk for colon cancer. Then there are a lot of genetic syndromes associated with cancer. Like we call the Lynch syndrome is the most common. And there are several of them. I probably will not bore you with them. So then for cervical cancers, having multiple sexual partners and having HPV, the human papillomavirus, that too increases your risk for cancer. Then for white people, another cancer that's very common among white people is skin cancers, melanoma, squamous cell, basal cell carcinoma, and that's due to sun exposure. So those are the risk factors, some of the risk factors for the common cancers we encounter. But by far and above, the most well-established cause is smoking.
I have a question. A woman who is between 45 and 50, right? No kids, but she's taken in and she's had abortion. Does it reduce it or does it increase her chances of cancer?
Can you say that again, please?
A woman, like you said, a woman who is between 45 and 50 years old. She doesn't have any kids, but she's had babies. She's taken in and she's had abortions. So since having kids late predisposes you, so having been pregnant and aborting the babies, does it help?
These are population studies and risks.
Yeah.
You can't narrow it down to predict for an individual person, an individual patient. And there are people like we all know that the greatest risk for lung cancer is smoking. But we see people that smoked 2 packs of cigarettes a day all their lives from when they were teenagers, and they live to 90, 95 years old, never developed cancer. And here we'll see a 50-year-old that never smoked, never even was exposed to tobacco, and they developed lung cancer. So there's a generalization. For an individual person, you cannot say, oh, this is what caused your cancer. Even for someone that smoked, we still say, even when we meet everyone will have a patient that smoked all their lives and they do develop lung cancer. We cannot say, well, your risk for this lung cancer is likely to smoking. But we cannot say with certainty that it is. But then there are particular kind of lung cancers that are tightly, very closely associated with smoking, like the small cell lung cancer, then we say, okay, that's what caused it. But generally speaking, it's difficult to link causation for an individual patient.
Okay.
Okay, can I read, there's a question here from one of our listeners. It says, please, can you list the kinds of food that may expose the body to cancer?
Like I say again.
I don't think you can list the food now.
Yeah, that's
I just have to read it.
I don't know that there is any food you should avoid to protect yourself from cancer, to avoid cancer. Me, I eat anything, I eat everything. I don't know that there is any particular food you should stay away from, avoid.
Just everything in moderation.
Everything in moderation, yes. And also it's a warning too, or maybe let me kind of make a warning about that, because I see people that just say, oh, like I've had patients, and sometimes they're the most difficult patients to deal with. They do not handle their illness like they say, oh, I've done everything right. I ate the right food, I exercised, I did everything, I didn't smoke, and yet I have cancer. And it's difficult for them to get to the headspace to deal with it. So you can live a perfect life and still develop cancer. But we're advised to do everything in moderation except smoking. Do not smoke in moderation. Do not smoke at all. Alcohol in moderation, every other thing in moderation. But
so in other words, doctor, can cancer be prevented?
Yes. Generally speaking, we know things that if you do, you stand a lower risk of getting cancer. But can cancer be absolutely prevented? No. The way I look at it, cancer is part of life, or part of, and this is not speaking medically. This is just speaking casually.
To us.
This is off the record. If you live long enough, cancer is almost part of the aging process. Like if a man lives long enough, they have a risk or a high chance of developing prostate cancer, just because it's part of the aging process. When the molecular basis of cancer, generally speaking, is that as cells divide, when you're younger, just if you look at your skin, as cells divide, the mechanism of cell division is very intact and well regulated when you're younger. But as you get older, all these body systems get weaker, break down. And that's why as you get older, you start having wrinkles and all that. So the same thing is happening in the cellular level, in the molecular level, that as you get older, the integrity of cell division is lost. And sometimes during abnormal cell divisions, mutations happen, and from there progress to cancer. So can it be prevented? Without, in absolute terms, no, but the risk can be reduced.
Okay, is it hereditary?
Some are hereditary, yes, that's a very good point to bring up. There are hereditary cancers, but they're in the minority, a lower percentage of cancers, breast cancers, colon cancers, even non-lung cancers. We really do not know a lot of hereditary predisposition to colon cancer. But yes, the breast cancer and colon cancer have a hereditary component. And if you have it, there's really nothing you can do about it. The risk of having it, let me not say there's nothing you can do about it. The most you can do about it is prophylactic surgery. Like Angelina Jolie did. She had the high-risk genetic abnormality that predisposes to cancer.
The BRCA.
And she elected to have bilateral mastectomies, even before she developed cancer, because her risk was really high. Yeah. So that's one thing you could do too. Yes. Oh, thanks for bringing that up.
Okay. Are there vaccines that can help reduce cancer risks?
Yes. The HPV vaccine is the one that's most well known. Also, the hepatitis vaccines. They're not really given to prevent liver cancer, but by decreasing the rate of hepatitis B infection of the liver, because hepatitis B leads to cirrhosis, and cirrhotic livers are prone to cancer. So secondarily, it prevents liver cancer in patients if it decreases the rate of development of liver cirrhosis. Then the HPV vaccine, like we talked about, HPV being a risk factor, cervical cancer, also for cancer of the anus. So most people have HPV infection. A lot of people, grown into from adolescence to adulthood and with sexual activity tend to develop or tend to acquire the human papillomavirus infection. And thankfully there is a vaccine now, but that's for the younger generation, which is why for the older generation that didn't get the vaccines, women are advised to have pap smears every year, every other year, depending on their risk level. So yes, those are the two vaccinations that could decrease the risk of cancer.
So at what age do we start screening for certain types of cancer?
Okay, very good question. So generally speaking, for women, the age to start screening for breast cancer is 40. And at 40 years, you should start annual screening mammograms. But women that have a family history of cancer, especially in multiple family, even female family members, or any male family member has had breast cancer, they should start screening about 10 years earlier. So if someone in the family had breast cancer at 45, they may start screening at 35, or they're recommended to start screening earlier. So that's for breast cancer, once a year mammogram. For colon cancer, previously it was recommended to start screening colonoscopies at 50 years and one every 10 years, assuming the first screening is negative. But now the recommendation has been lowered because there's been an increased incidence of young individuals or young persons developing colon cancer even before they turn 50. So the screening age has been lowered to 45. And that's especially for Black people. Black people kind of have a higher incidence of developing early and aggressive colon cancer. Also for breast cancer, Black women have a tendency or have a higher risk of developing early or breast cancer earlier than white women do. And then again, the breast cancer they develop is the highly aggressive form, the one that's called a triple negative breast cancer that's associated with higher risk of spread and mortality. Then for lung cancer, the screening for lung cancer is based on a smoking history. Like the screening is for patients that or individuals that have smoked a pack of cigarettes a day for more than 30 years and are 55 years or older. It's recommended to have an annual chest CT to screen them for lung cancer. And we previously talked about pap smears every couple of years for women. So those are the screenings for the more common cancers. Then for men, especially due to the men for prostate cancer, it's recommended that men that have a family history of prostate cancer start screening early, maybe about 40, 45 years old. Probably about 45 years old with PSA, especially if you have a family history of prostate cancer. But a lot of times men are recommended not to use PSA, not to do screening PSA because especially if you do not have a family history of prostate cancer, because there's been a tendency to overdiagnose prostate cancers that still are not clinically meaningful. Say, like we talked about earlier, if a man lives long enough, he will develop prostate cancer. But is that prostate cancer of clinical significance? And that's where the judgment comes from, because not all prostate cancers are aggressive. Same like breast cancer. Breast cancer is like calling, oh, there is a dog. But there are different types of dog. There is a Chihuahua, there is an Alsatian, there is German Shepherd, and they are different sizes, behave differently. So breast cancer, like all cancers, are just a name given to a diverse range of diseases that have different behavior, different biologies, and they're treated differently.
Okay.
Okay. I have two questions from our viewers on Facebook. One is from Mary, and she says, he talked about contraceptive causing cancer. Please, can he break it down? And then the second question is from Adibeli. She says, what is the cause of prostate cancer? Is it lack of sex?
I hear that though.
Okay, we'll start with the last. No, there is no evidence that lack of sex causes prostate cancer.
Oh, so papa doesn't prevent it.
As far as I can tell. So in terms of contraceptives and breast cancer risk, It's all about exposure to estrogen. It's all about exposure to estrogen. Most breast cancers, the majority of breast cancers, maybe even 80% of breast cancers are estrogen receptor positive. Let me back up a little bit. Estrogen exposure increases the risk for breast cancer. That has been proven. And contraceptives, hormonal contraceptives that contain estrogen increases that risk. Barrier contraceptive methods like the diaphragm or condoms do not increase cancer risk. It's the
IUD. So IUD increases your risk for cancer?
No, it does not. It does not increase. Non-estrogen containing IUDs. IUDs that contain estrogen, yes. But non-estrogen containing IUDs do not increase the risk of cancer. What increases the risk is estrogen, is the estrogen component of the contraceptive. And also for women that do eventually develop breast cancer, the most common is the estrogen receptor positive breast cancer. And what that means is that the cancer cells are stimulated by estrogen. So part of the treatment for women with estrogen receptor positive breast cancer is anti-estrogen therapies that deprive the body of estrogen.
Okay, I'm good.
Yeah, thank you. Thank you, doctor. I don't even know where to start. It's my birthday today. I'm excited, but again, another sad day. I lost my very close cousin, first cousin to cancer yesterday morning. So sad.
Can we give it a 1 minute? 1 minute. You want to give it 1 minute silence for your cousin?
Please. Yes, please. May the soul of Uzoma Nwakuche and all the faithful departed rest in peace.
Amen.
Amen.
You good?
Doctor,
can you talk?
Sorry. Yeah, I can. Doctor, I live in UK and you talked about the age for screening. I'm 44 today. I haven't even had the first screening of anything, any sort. But again, smear tests we do regularly.
But you guys do smear tests 2 years. You told me you guys do 2 years. We do one year.
Can I add to that, Ifeoma? Can I add to that? Okay. Because we both live in the UK. It's your duty to talk to your GP to go and do what I call body MOT. Don't wait. There is absolutely no doctor in this UK that would call you to recommend mammogram for you.
I told her, me and Ifeoma argued 2 years ago. I told her pap smear we do yearly. She says, I've got 2 years ago. She said, no, you guys do 2 years.
So we do pap smear.
We do yearly.
We do the test here every 3 years.
Smear.
Yes.
Oh,
smear.
3. Here I do every year. I do the pap smear, I do the mammogram, and I do the ultrasound because they say I have dense breast. So I do both ultrasound and the
what
mammogram.
happens is you could always, because from this journey, I've got to learn, I do have a vast, vast set of knowledge of what you need to do, what you don't need to do, because sometimes what applies here in the UK doesn't apply in the States. There are two different.
I'll talk to you later about it, Kolia. Okay. I'll ask you for advice on that.
If I could quickly add to what Doctor said about estrogen receptor, I completely agree with him, because mine is hormonal. Any cancer that is hormonal receptive, you have the chances, as they say, of for it. Sometimes it might come back. So that's why 90% of the time, where you're placed after all your treatment, you're placed on hormonal something just to shut your system down. So for example, I'm on tamoxifen and I'm going to be on it for 10 years. So obviously what happens, you go into early menopause. So what they're trying to do is to shut everything down. So more
estrogen.
Yes, no more estrogen. So, which is, I always say to women, I have a friend who was given tamoxifen and she said she wasn't going to take it, you know, and cancer is a personal journey. So it depends on how you could always advise people. It depends on how people want to go walk through that journey. And I always say, I for one, I always use what is called the cognitive behavioral therapy. So the perspective, the mindset, the connection between my mind, my feeling, and my action matters a lot. So it's about it for me. It's about seeing the glass half full rather than seeing it half empty. Yes. So
we have the doctor for 1 hour. So can we just finish asking him the questions so that?
Okay.
No, I enjoy hearing from Ada, and maybe, you know, because she's gone through the personal journey, and maybe I think you should hear from her because she's a strong woman. What she's gone through and how she's gone through, it's admirable.
Okay. All right. Yeah. My question too.
I'll just complete. So behavior reinforces the thought, and the thought creates the feeling, and the feeling creates the behavior. So it's
say that again.
So behavior reinforces your thought. Thought creates the feeling, and the feeling creates the behavior, and it goes right back. So in the journey, you have to sit down and say to yourself, do you want to survive? If you say yes to yourself, how do you want to go through that journey? So you now have to start mapping out, this is what I want to do, and this is what I want to achieve.
Thank you. Kolia, can you put in the comment section this cognitive cycle you've just mentioned?
I just wrote 3 of them: behavior, thoughts, and feelings. I couldn't write the whole thing.
So just give us a comment there. Going back to the doctor.
And Kolia, can you go on the chat? I think so many people have questions for you. If you can just please answer.
Which one?
The chat. I see people asking questions about cancer. See if there's anything for you.
Okay, I'll do that.
Yeah, so carrying on, Dr. Uzo. Is it right to say, okay, the question is, can you talk to us about the cancer diagnosis and treatment? Before you tell me that, can I say, is it right to say that Kolia self-diagnosed herself?
Yes.
So yeah, tell us about diagnosis and treatment of cancer, please.
You see, I keep going back to this. You have to forgive me. Maybe I'm a little bit technical, but when you say diagnosis of cancer, there are 100, 200 different kinds of cancer. So maybe let's narrow it down to breast cancer, if you.
Okay. Yeah.
So breast cancer is diagnosed in different ways, or it presents, patients present in different ways. A typical way is the way Ada presented. A woman is taking a shower and feels a lump, and from there goes to her doctor for further evaluation, and from there it is diagnosed with following mammograms and other imaging studies. Then they go ahead with a biopsy that proves there is cancer. Then the next step will be how far gone is it? How far gone is the cancer? And that's a different discussion. Then there are other ways the breast, another common way is with screening, which is the screening mammogram that women are encouraged to do every year from the age of 40. So women may go 10 years, 20 years, regular yearly screening. Then the 21st year, they see something or something is found. A woman may go on the very first mammogram and something is picked up. A woman may go and just because of an abnormality may be noted in the mammogram, then they'll say, okay, maybe come back in 6 months. Or this is iffy, let's repeat it in 6 months or come back in a year. Then then things are found. The worst type, or the worst presentation, because typically patients that present with a lot and often screening mammograms are picked up early. And the earlier you pick up cancer, the greater one's chance of curing it. So the presentations that we kind of we dread is women that come in with a headache. A woman comes in with a headache. I've had patients that came in with a headache and persistent headaches. Then you go do a brain CT and there is a mass in the brain. Then you now start looking back to examine the woman and do more scans. Then you see she has breast cancer. A woman comes
from brain to breast.
What?
From the brain tumor to breast?
No, it's the breast tumor that went to the brain. But the breast tumor wasn't found early enough. So it was found at an advanced stage, a metastatic stage. It's gone from the breast to the brain. Sometimes women also come in with severe back pain, unrelenting back pain. They've been taking pain medicines for, sometimes they go to the chiropractor. Then maybe someone will say, okay, let's do a scan and see. They'll do a scan and then they see there are lesions on the skeleton. And you now look back, or further evaluation shows she has breast cancer. When you do a biopsy of the skeletal lesion, then you see it's actually breast cancer that has spread to the brain. So these are different ways that women present with breast cancer. Lung cancer is the same too. You can present for lung cancer. Typically, patients present with advanced stage disease, being that they become symptomatic. Either they cannot breathe, they are having a lot of cough, coughing up blood, or having a brain lesion with headaches, dizziness, unconsciousness. So patients are passed out because of the size of the brain tumor. And then when you look back, by the time you look back and you do the imaging studies, you see it started in the lung, but they had already spread to the brain. And the worst types, let me not call them the worst, the worrisome presentations of cancer are cancers that do not have screening, that do not have a screening schedule, say ovarian cancer and pancreatic cancers. Those are the common ones that present at advanced stages because they do not have specific symptoms. Their symptoms are very, very non-specific. Abdominal pain, weight loss, nausea, non-specific symptoms, abdominal bloating. Then by the time these symptoms would have lasted or typically last several months before they now, sometimes they may keep going to your doctors, but common things occur commonly. Once someone has an abdominal pain, the more common thing is that they have a peptic ulcer disease or having digestion or something, not that they have cancer. So by the time they get around to diagnosing them with cancer, it's far advanced. So these are some of the examples. So I was just trying to tell you that presenting or diagnosis of cancer comes in different ways.
So the treatment, because the question is diagnosed, how is it diagnosed and the treat and how is it treatment? So is it the same for everybody? Does everybody have to go through chemo, radiotherapy, or is there different?
Yeah. Okay, the treatment is based on the stage.
Yeah.
The treatment is based on the stage. Generally, there are 3 treatment options a patient, or 3 treatment modalities that we have in oncology. One is surgery. The second one is radiation. The third is chemotherapy. And when I say chemotherapy, it's a broad term. It's a broad term that I'm going to explain in more detail later. So surgery is when the cancer is found early and it can be removed in its entirety, like it can be removed completely. And so, sometimes we use a combination of surgery, radiation, and chemotherapy, or sometimes just one. So surgery is is typically for early stage cancer, that you can cut it out in it completely and you do not leave any cancer behind. That's the aim of surgery. If one has cancer that surgery cannot cut everything out completely, then they're not eligible for surgery. Surgery isn't recommended, and that's typically for stage 4 cancer. So for maybe I should have said this earlier, cancers are typically divided stage 1, 2, 3, 4. Yeah. Stage 1 and 2 are early, stage 3 and 4 are advanced, but then stage 4 in particular is metastatic, is real advanced. The intent or the goal of treatment for stage 1, 2, 3 cancers of almost every type is cure. You aim for cure. Go ahead.
Could you also expatiate, because people get to confuse stages with grades, because cancer has got stages and grades as well.
I think it's maybe a little bit too technical for the audience. Okay. Yeah, it may be a little, narrowing down to the tumor, the node. Yeah, it's going to be a little bit too technical. This is probably just a general discussion, but I think it suffices to say that cancer stage 1, 2, 3, 4. Stage 1, 2, 3, you aim for cure. Stage 4, you aim for palliation. So the modalities are surgery, radiation, and chemo. And sometimes you can use them individually or concurrently, or one after the other, or you can use all 3. So the lucky people are those that can have all 3, those that can have surgery, radiation, and chemo, depending on the kind of cancer. So if you start with breast cancer, or if you use an example with breast cancer, all 3 typically are used for early stage breast cancer. Early stage breast cancer, you do surgery first, then radiation, then sometimes you do chemo first before radiation. Then if you're going to do, but if you're not going to use chemo, then you do the radiation, then you subsequently do a pill. And that's what I was going to expand on. Chemotherapy is a general name given to treatments that you take by mouth or by injection to treat cancer in the whole body, wherever it may be. But everything we use in treating patients is not chemo. You have chemo, you have immunotherapy, you have targeted agents, then you have hormonal therapy too. So back to breast cancer treatment. Why all these modalities are used is because the problem with cancer is not just that a tissue, a piece of cell. It starts with one cell, then grows and grows, becomes a tumor. It's not just that a piece of cell or piece of tissue grows and the body loses control of its growth. It's that it spreads. That's the biggest problem with cancer, is that it spreads. It doesn't stay where it started. It could break off and go to satellite locations and continue to grow. And that's what makes cancer difficult, or cancer treatment. That's what causes mortality in cancer, the metastasis, not the primary cancer itself.
Wow.
So, yeah, that's not the primary cancer itself. So radiation it's not applicable for all kinds of cancer. Like we use radiation treatment in, say, breast cancer, brain cancer, lung cancer, but we don't use it in colon cancer. It's a bit technical trying to explain why we don't use it. We only use it in organs that are fixed to one spot, that do not move around in the body. So, so those are some of the treatments we have: surgery, radiation, and systemic therapies, not just chemo. You have chemo, immunotherapy, targeted agents, and endocrine therapy.
Okay.
But may I just ask the doctor, please, do you use oxygen therapy at all in treating cancer?
No.
Oxygen therapy?
No, not really. No, not really use oxygen in treating cancer, no. It's just a supportive care, and it's not particular to cancer. Say patients that have difficulty breathing for whatever reason, not whether it's cancer or not, are put on oxygen, but oxygen itself does not treat cancer.
Question, doctor, is it correct to say that cancer has a cure? Can be cured? Let's keep going.
No, it is incorrect.
So tell me.
At least as of 2020, it is incorrect. Cancer can be cured, but cancer does not have a cure. Cancer is part of the, like I was saying,
you said cancer can be cured, but it does not have a cure.
Okay, let me try to explain that. Cancer can be cured. And when I say cancer can be cured, you see why I keep trying to narrow it down to be specific.
Yeah.
If one has early stage, say stage 1, 2, 3 breast cancer, potentially it can be cured. With surgery, radiation, chemotherapy, potentially it can be cured. But can the human race rid itself of cancer? The answer is no, as of 2020. Yeah.
Okay. Yeah. My other question, I'll give it to you, Kolia. Is cancer, from your experience, is the treatment of cancer worse than the cancer itself, the effects of cancer in the body?
The treatment side effects, you mean, right?
Okay. First and foremost, it depends, because people go through different kinds of treatment. So your question is the treatment worse than the cancer
itself? Yeah.
Most people don't die of cancer. Most people die of ignorance. Because when people die of ignorance, because once they hear that word cancer, their mindset changes, and all they are thinking about is cancer has killed Mr. A, killed Joe Block, killed this person. So the treatment, like I always use myself as an example. Once you're told, most people that die of something, they don't die of that illness. They die of their mindset, thinking too much, that thing is
fear. The fear of the disease.
Yes, the fear. So the treatment, for me, when I was told, I would say the hardest part of the whole journey was the chemotherapy, because it messes up everything in your body. Every single thing in your body is messed up. So the hardest part was the chemotherapy. However, I always say to people, take different things differently. So I always say to people, when you're going to take any form of, it's just like maybe somebody going into surgery, you're thinking, oh, will I come out? Will I not come out? So I always say to people, when you're going into, if you're, first of all, once you're told you have chemo, you have cancer, just think positively. Yes, you've got cancer. Cancer is not the big C as far as Solumkolia, is concerned. Christ is the big C. So the main thing is to hold on firm. Doctors I'm very sorry, but I just have to say this. Doctors will load you with a whole lot of rubbish information, and they are only doing their job. Obviously, they will tell you the kind of things you do not want to hear. And doctor is here. Chemotherapy, the chemotherapy medication, it's poison that they inject into the body. It's absolute poison, because it will kill the cancerous cells, and also, if you're not careful, it will damage the good ones you have. So that's why most 90% of the time when you're going through chemo, once you do the first cycle, what they do is, before you do the next cycle, you have to do a complete blood count. You have to go through blood tests differently. The doctors know what they are looking out for. So if your white blood cells are below the standard they want, you're not going to go through the next chemotherapy. What they will do is they will now start
Yeah, Kolia. Yeah, Kolia. I think, Jared, the way I believe, and from people I speak to in the medical field, every medication, it's poison.
Of course.
Was it on it? So don't you think that that thing you consider rubbish from the doctors is just the reality, just that you don't want to hear it?
No,
Or
that's why I said, when you're given the information, you are fed the information. Some people will tell you, I know somebody who was told they have cancer, and the person said to the doctor there and then, it's not my portion. Whose portion is it? It's not your portion. You go home, but today, but today she's dead. She refused to take chemotherapy when her cancer was still on stage 2. What I mean rubbish in the sense is that all the informations you get is so much. To be honest, it is so much. If you have to start, like through my journey, I had to. I'm publishing my first book soon, which will come out in a few months' time, and it's just a story. It's just the story of my journey, you know. So there's so many information you get.
And try and start a blog. Try and start a blog on Facebook or where, so you can help people and give information.
I'm trying to do that. So you know, the information we get, the doctors are doing their job, obviously, but I give credit to the doctors in the Western world. Okay? Doctors in Nigeria, for example, over here we have doctors who are GPs. We have oncologists. Now in Nigeria, there are doctors that are warrior everything. They treat everything. For example, I'll give you just a quick example. I was on a call, the kind of thing there was a lady who did not have, a lady who went to the doctor.
Can you guys mute yourselves? Somebody's TV is on.
There was a lady who went to the hospital, and you know, for some reason, the doctor said to her, "Oh, since you have cancer in your lineage, you know, we're going to treat you, give you chemotherapy so that you don't get the cancer." That's absurd. You know?
Anyway.
Yeah, things like this happen. It's not that the doctors are not, they are doing their job. They tell you, they say the way they see it. But I would always say to somebody, when you're don't take my own, you know, my own journey might be different. If you're back home in Nigeria, I will always say to you, once you're told you have cancer, please seek a second opinion from a qualified oncologist, not a general practitioner, because
anyway, Thank you, Dr. Uzoma. No disrespect to you and other doctors in the show today. I think that's my question. Waps, back to you.
So, let me just
go ahead.
Okay, go on. Please, after the doctor, I'd like to say something.
Uzoma, go ahead.
So let me elaborate on that question. You know, when she asked, does cancer or does the treatment of the disease, is the treatment of the disease worse than the disease? So I think the odds, and I understand what the doctor is saying, the odds doctors saw is first do no harm. No, it's do no harm. From what she said, you're overloaded with information, and because you're in the West, that if you're in Nigeria, they'll just say you have breast cancer. This is what you need to do. Do it. If you don't do it, you cannot do the real physicians in back home in Nigeria will not even bother to explain. But here now, because they want you to share responsibility in making the decision. Nobody makes the decision for you. They want it to be a shared responsibility. Because they want to make it aware. They're not just going to say, "Oh, madam, you have breast cancer. You're going to start chemotherapy tomorrow. Do it or don't come back." So that say that sometimes everything is a benefit risk assessment whenever one has cancer. Say a 45-year-old female with stage 3 breast cancer it's a totally different scenario from an 85-year-old woman with the exact same disease. 85-year-old woman, maybe with stage 3 breast cancer, but then she has diabetes, she's in a wheelchair, she lives in a nursing home. That kind of patient, you say, well, go home, do what, it may just, at the most, you may just do the mastectomy, or you don't even give them any treatment, maybe just give them the tamoxifen or anastrozole and say go home, because the burden of treatment may be more than they can bear. So it's all a benefit. Sometimes you can find a 40-year-old woman with stage 3 breast cancer that can potentially be cured, but then she has multiple sclerosis, she's in a wheelchair, or she has maybe some central nervous system disorder that she cannot make an informed decision of that she needs help, even sitting up or eating her food. That patient, you're not going to offer her any kind of aggressive treatment. So it all depends on what's in front of you. So it's not one cap fits all. And sometimes, yes, the treatments may be worse than the disease. If the physician isn't careful or the patient is not informed, the treatment may be worse than the disease when, if, say, a 75-year-old woman with stage 4 breast cancer, stage 3 breast cancer tells you they want everything done. Sometimes it's my responsibility, and sometimes I actually do it. Try to persuade the patient not to go through treatment, because you'll think the treatment may be too much for them to endure. Part of our care, we usually have hospice nurses, palliative care nurses on staff in the cancer center, or even when the patient is diagnosed with cancer, we typically refer them for counseling to know what they're about to go through so they know what to expect. And some patients, we actually encourage them not to go through any treatment. But generally speaking, for a young woman or man that comes in front of you with potentially curable cancer, you push the envelope. Sometimes you almost take them to the point of death, because we know that we can salvage them. Like if they go through this valley of shadow of death for 6 months or 3 months, they may have 6 years, 10 years, 20 years to live. So it is a challenging situation that you tend to weigh the benefits and the risk. What are you facing and what do you aim to achieve? So that's what it is. So I will not say on the offhand that the treatment of cancer is worse than the disease itself, no. But sometimes it could be that way if one isn't careful.
All right. Thank you, Dr. Uzoma Nwakuche. We appreciate you. Thank you so much, Solumkolia Obi Anazodo, for your bravado, for your strength, and for you supporting everybody. We hope everything works well for you. So in summary, because cancer is preventable. I'm going to mute you.
Yeah.
So we have to have good nutrition. We have to check ourselves yearly or twice a year. You have to exercise. You have to stop doing things that will increase your chances of Getting cancer. So having said that, thank you everybody for joining us. Today is 1/4 of us. Ifeoma Mama Badnuju. Ifeoma Mama flipped her page 44. So if you guys can stay with us, we're gonna celebrate Ifeoma's 44th. She's an old lady, so she needs to get her pap smear. You need to go do your pap smear. You need to go do your breast exam. And ladies, please check yourselves every day. Yes. So, Anadia, you want to say something before we move to Ifeoma's birthday? And Winifred will go.
Out of my mouth. I just want to say to you, ladies, please, please, please check your lemons every day.
Yes, every day. Check it. Put your hands on. Put your hands like this, right, and then check it. Yeah. So, Winifred, over to you.
One other. May I just quickly give the advice, please? Now, cancer is preventable. You see, the reason why we have all this cancer thing is because of the modern age. Yeah, our people in the olden days, they don't know anything about cancer. Yeah, now what we had,
Daddy, there was no family. There was no family history. There was no family history. So
Uncle,
maybe they had cancer, but we didn't
I
know.
completely disagree with you.
I disagree with you because I have a child with spinal bifida. How do I know that years ago my grandparents didn't have, their kids were having kids and their kids were dying. So there's no family history. There's no family history to prove that.
Well, as far as I know, we have family history in my area. Yeah. Anyway, another thing that I want to say is that people should start to avoid all this processed food, because the processed foods are filled up with additives, you see, and things like that. So we are advising people to try and feed their body with natural ingredients, natural food.
That's always good.
Yeah.
That's
yes,
always
please.
good. That's good nutrition. Eat good nutrition. Yeah.
Yes, exactly.
All right. So Winifred, go ahead.
Thank you, everybody. We would like to say a very big happy birthday to one of our own. Former mom, Mbadinuju, a very enigmatic and opinionated person.
Tell me about it.
Very loving, kind, and intelligent individual. On this our special day, we wish her all that she has ever hoped for and many more.
Thank you.
And we pray that the Almighty will continue to guide her in his ways and also perfect all that concerns her in Jesus' name.
Amen.
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 Thank you very much. Thank you, my Oche Kitchen family. Thank you, everyone, for being part of this show. Thank you so much. Thank you. And we love you all.
Happy birthday,
Love you.
Thank you.
I have my cake and my wine.
Happy birthday to you.
Thank you. Thank you.
Happy birthday. Happy birthday, dear mama.
Music loud and women want to bring kicks around since I was born. Now it's alright, that's okay. You may not be our way. We can try to understand. New York Times are back on land. Whether you're a brother or whether you're a mother, you're staying alive. Staying alive. Everybody shaking, we're staying alive.
Raise your wine and your shake. Happy birthday, Forma. God bless you. Happy birthday, see mommy. Enjoy your day.
Happy birthday, Ify.
I'm here, Forma, I'm here. Thank you, Daddy, I see you.
Happy birthday, Ify.
Bye bye, everybody. Forma, happy birthday. Enjoy your evening. Thank you, everybody. Thank you. Happy birthday, Forma. Thank you. I see you. I see you. Happy birthday,
Play your favorite music.
Happy birthday. Thanks, everybody. Bye.
Thank you, Mama. Thank you, Warren.
Yes,
Okay, so we can see you guys. You're so quiet.
I see you.
still I had to try. Yeah. Oh yes, let me get my words right and then approach. When I'll treat you like a man is supposed to. You never have to cry. No, I know everyone can relate to when they find a special someone. And she's royal, yeah, so royal. And I want her in my life. I never knew anyone so one of a kind. No, the way she moves, she has the qualities of a queen. She's a queen. Ooh, ooh, what a natural beauty. You need to be a beauty. She's a queen.
I'm already on my feet.
That's what a good woman's made of. She's not afraid and ashamed of who she is. She's royal, yeah, so royal. And I need her in my life. I never knew anyone one of a kind until the night that I seen your eyes. My queen, so sweet. I can see it in her eyes. The way she smiles. Hey, yes, I know the king and queen crown, same time. So I never leave your side. Just stick with me through trial times. And she says she no mind. Right, I know good man is hard to find. And she can't about that shine. That's why she has eyes at this time. Yeah, I know many men are trying, but she needs to be more than wine and dine because she's royal, yeah, so royal, and I want her in my life.
Just know next week's topic is 40 plus health. I know what for you under 40. Find us and know what happens when you're 40.
We are 40 and above, and you what's that? Are you telling us that we are old?
If you're young, you're quite young.
40 plus. I'm not talking about
40 plus, the next weekend. Okay, I'm going.
the way she moves, you are home. Queen, so supreme. Ooh, natural beauty. No need no makeup. I'll be a cutie.
Stand up.
So supreme.
You can change the music now.
I'm not ashamed of who she is. She's
Hey, this party. Oh, no, don't get drink.
Baby, you pull over. Baby, you pull over. Show me your particular, baby, pull over. Baby, you pull over. In a light, baby, you pull over. Baby, you pull over. Back, baby, you pull over. Show me what you got. Baby, you pull over. Reverse, baby, you pull over. Show me your particular, baby, pull over. Baby, you pull over. In a light, baby, you pull over. Baby, you pull over. I mean, you don't like to dance. Me like to dance. You don't like to wine. Me like to wine. We are wine and I wine to the center. You know, say we there for your matter. Boy, you tell all your friends like I'm whiskey, they're back while I'm not so. I'll take you around the world, my baby. Baby, baby. Baby, you pull over. Reverse, baby, you pull over. Baby, you pull over. Show me your body, baby, you pull over. Baby, you pull over. In a light, baby, you pull over. Baby, you pull over. Back, baby, you pull over. Baby, you pull over. Reverse, baby, you pull over. Show me your body, pull over.
My friend, stand up and dance. Look at my nose now.
See, I want to see your video. I thought you have my dance now.
I'm with you, my nobody can love you the way I do. We do everything is well, you love they make my heart to do yori. Nobody can love you the way I do. I'm with you, my love. Same thing, way they make me feel like say you go be my wife. Now the same thing whipping they make my friend talk say I didn't waste my time. Because I didn't respect you, girl. For you every night and day. I pray for you because of you.
Please stand up and dance.
My love, this thing make people they say I don't lose my fix my brain, but nobody can stop me from loving you. I'm with you, my lover. With you everything is well, you love me, make my heart yori. Nobody can love me the way I do. I'm with you, my lover. With you everything is well, you love me, make my heart to do yori. Nobody can love you the way I do. I'm with you, my lover. See the way they flow. I'm surprised to see how they love you so. Girl, I just suspect, say them no. Say that you be the person where they make me flow. Ooh, tell them, say you are a blessing. And that's why you are so interesting. Nobody is understanding the way you do. Oh, my beautiful girl. Now all this make people, they say I don't lose my face, my dream. But they can't stop me from loving you. With you, my love. Do everything is well, you love me, make my heart yori. Nobody can love you the way I do. I'm with you, my love. With you, everything is well, you love me, make my heart to do yori. Nobody can love you the way I do. I'm with you, my love. Your love would be effect to my brain. Do they make me go insane? It go make sense in my face. You know here I will talk again. Your love would be effect to my brain. Oh my love, how they go insane. Just leave them the way he be, the way he did. Now all this make people they say I don't lose my sex, my brain, but they can't stop me from loving you. I'm waiting, my love. Everything is well, you love me, make my heart to do yori. Nobody can love you the way I do. I'm with you, my love, the way I do. Everything is well, you love me, make my heart to do yori. Nobody can love you the way I do. I'm with you, my love. Everything is well, you love me, make my heart to do yori. Nobody can love you the way I do. I'm with you, my love. With you, everything is well, you love me, make my heart to do yori. Nobody can love you the way I do. I'm with you, my love. Yeah, yori, yeah, yori. They come zile. My love, ooh, my love. Nobody can stop me from loving you. I'm with you, my love.
Okay.
No
Bye. Party over. Party over. Hey, let's finish this one before you stop this program.
New school.
For this world, the good they die, and for the bad,
Nigerian music. She loves all Nigerian, but mainly 90s. So she's playing whatever she loves today. Hey, Isi Mama, is this you?
Good girl.
Tell me my temperature. Do you have temperature?
I'm a strong Me and Romeo ain't never been friends.
Come on, we didn't even wish happy birthday to Chizitalo. Ifeoma son shares the same birthday as her. Chizitalo. So happy birthday, Chizi, our chairman.
Every man deserves a good home, and I want you to be my wife. Time is so much better spent, baby, with a woman just like you in my life. So let me love you. See you up and I want to hold you, baby. Don't you know that I'll get down on my knees for you, babe? You see, I'm a
Thank you.
Me and Romeo,
let's grandma.
Just see how much I really love you. Bring it to you time and time again. Oh,
Happy birthday, Papa.
Time I won't see. I can't find the words to tell you so. Love. You let me in. Your touch filled me like the rush of the wind, and your arms have held me safe from a rolling sea. There's always been a quiet place to harbor me. Our love is like a ship on the ocean. The cargo of love and devotion. So I'd like to know where you got the notion. I'd like to know where you got the notion. Don't rock the boat, baby. Rock the boat. Don't tip the boat. Rock the boat. Don't rock the boat, baby. Rock the boat. Up to now we sailed through every storm, and I've always had your tender lips to keep me warm. Oh, I need to have the strength that flows from you. Don't let me drift away, my dear, when love can see me through. Our love is like
You just go, and you just go.
Love and devotion. So I'd like to know where
You got the notion. I'd like to know where. You got the notion. So I'd like to know where. You got the notion. I'd like to know where. You got the notion. Rock the boat. 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 Rock
Thank you, everybody. Be here next time next week. We love you all. Mama, happy birthday. Okay, we love you.
Happy birthday, Sister Ify. Many more years to you.
Happy birthday, we love you.
Anybody who has anything to say to you before we end?
Okay.
Okay, Chidinma, you have something to say to Ifeoma?
Happy birthday. Hello. This is your birthday. I wish you happy best today. Have a fabulous birthday and may God prosper you. May God keep you. May God give you good health. And to your son too. God will keep you flying forever. Let's be have fun and enjoy the
Stop the
rest
music
of the
so you can hear what they're telling you. All right.
Thank you very much. Thank you.
All right.
Freedom for the baby child.
Peter, you have anything to say to Ifeoma?
Ify, happy birthday to you. May the Lord bless your new year.
Amen.
And your new age.
Amen.
Welcome to the club.
Thank you very much.
Since 10 years ago. 10 years ago. All right, thank you, everybody. We love you all. Thanks for joining us. Bye.
Miss Ify, have fun and my love to your son.
Thank you.